Hello, welcome to Dental Notes and Mnemonics. Today we are going to discuss about cracked tooth syndrome. So without any delay, let's get started. Cracked tooth syndrome may be defined as a fracture plane of unknown depth which originates from the crown, passes through the tooth structure and extends subgingivally and may progress to connect with the pulp space and or periodontal ligament. It has a crack, it is not easily visible and it does not split the tooth into two parts. This condition is common among the adults, particularly in the molars where the heavy chewing forces can create microfractures over the period of time. So let's talk about the classification for the cracked tooth syndrome. Association of Endodontists has identified 5 types of cracked teeth, which may vary in severity from minor enamel cracks to more serious structural damage involving the root of the tooth. One is graze lines. Graze lines are the small, visible fractures contained within the enamel. These fractures don't penetrate the deeper layers of the tooth but can still be noticeable. In posterior teeth, graze lines usually cross the marginal ridges and may extend along the buccal and the lingual surfaces. In anterior teeth, long vertical graze lines are commonly seen. These fractures are often caused by normal wear or trauma that places the stress on the enamel. Then the second one is the fractured cusp. Fractured cusps occur when a crack starts at the crown of the tooth and extends into the dentine, ending at the cervical part of the tooth. These fractures are typically seen in the teeth that are heavily restored, where unsupported cuspal enamel is more likely to break. Over time, the stress from chewing or the large restoration can cause the enamel to fracture, exposing the dentine underneath. Third classification is cracked tooth. A cracked tooth is characterized by a crack that extends from the occlusal surface of the tooth, running apically but without causing the separation of two segments. This crack is usually centered in the tooth in the mesodistal direction and may involve one or both marginal ridges. Cracked teeth are generally the result of stress or trauma that causes the crack to propagate without fully splitting the tooth. Number fourth classification is split tooth. A split tooth occurs when the crack extends through both the marginal ridges, completely separating the tooth into two individual fragments. This type of fracture is often the result of crack propagation, where a small crack in the tooth expands over a time due to additional stress, leading to the full separation of tooth into two parts. It is more severe fracture compared to the cracked tooth and typically requires a complex treatment. And last one is the vertical root fracture. Vertical root fractures start in the root of the tooth, usually in buccolingual direction, and can affect the entire root or just a portion of it. These fractures may or may not be complete, but often involve only one surface of the root. Vertical root fractures are typically caused by internal stresses within the tooth or a trauma that affects the root. Predisposing factors to cracked tooth syndrome are previous cavity preparations, because the teeth that had cavities filled in the past may have weakened areas, making them more likely to crack. Heavy fillings, especially the large one, can create stress points. The shape and the position of the satin teeth can make them more prone to cracking, especially the molars. Wear and tear at the base of the tooth near the gums can weaken the tooth over time, making it more vulnerable to cracking. Everyday chewing, especially on the hard or the tough food, puts strain on the teeth, and they may have small fractures as well. Habits like grinding or clenching, especially at night, can also put extra force on the teeth, making cracks more visible, likely to develop. About the clinical features of cracked tooth syndrome, the patient may feel the pain when biting, having cold food or sweet foods. Rebound pain is there, After releasing the pressure on the tooth, the pain can suddenly appear. This is called rebound pain and is often felt when eating food that are difficult to chew. Pain from tooth grinding. Some people may experience pain while grinding their teeth or moving their jaws side to side. This may be due to involvement of cracked part of tooth during these actions. The pain is hard to locate. The exact pinpoint location of the pain which is causing the pain is difficult for the patient because the pulp does not have nerves that help us to sense position. One clue that someone might have cracked tooth syndrome is the absence of heat sensitivity, which is uncommon in other tooth problems. The patient may have the chronic pulpitis, and the cracks may cause a chronic inflammation inside the tooth even if there is no clear symptoms. This happens due to leakage of bacteria or toxins from the crack. So let's discuss about the clinical examination of a cracked tooth syndrome. It can be examined by using a sharp probe. Applying a sharp straight probe to the margins of heavily restored teeth can provoke sharp pain, suggesting an underlying crack. A tooth may present with the wear facets, which indicates the teeth at risk from the lateral forces and potentially contributing to fracture. Heat or cold test may be done for the further evidence of a crack. Rubber dam usage helps to isolate the tooth, making crack more visible by providing a clear background and keeping the area dry. Periodontal probes helps to differentiate between the cracked and the split tooth by identifying localized defects. Dye test uses a dyes like methylene blue or gentian violet, which is used to highlight the cracks. They can reveal the cracks easily. Dye test pressure is applied to individual cusps to elicit pain. Bite test is done with the help of a tooth sleuth, which is a simple tool. It is a small wedge-shaped tool, helps to locate cracks that may not be visible but cause pain when the pressure is applied. The dentist places the tooth sleuth on the top surface of the tooth that may be cracked, and the patient is asked to keep biting for a few seconds to let the pressure settle on the tooth. Then patient releases the bite. If the tooth has cracked, pain typically occurs when the pressure is released, helping pinpoint the affected tooth. Vitality tests are done to know the pulpal status or the response of the tooth to hot and cold. Radiographs may also be taken to assess the status of the tooth structure. Apart from the dye test or bite test, another diagnostic method for cracked tooth syndrome is the transillumination. Transillumination, a technique, uses light to detect the cracks in the teeth. It uses a high intensity light source like fiber optic light, which is directed onto the tooth, and light passes through the tooth structure, illuminating it from one side. When there is no crack, the light travels evenly through the tooth, lighting up the entire structure. However, if a crack is present, the light will scatter and stop at the crack line, creating a shadow effect. This break in the light path makes crack easier to see. So now let's discuss the management part of cracked tooth syndrome. But before that, we will discuss about the preventive measures to avoid cracked tooth syndrome. Caution should be exercised with certain food which are hard. Avoid hard object chewing. Clenching and grinding should be reduced, especially during the stressful time. Mouth guards or the retainers to minimize grinding or clenching impact, and using or wearing a protective gear during contact sports like mouth guard or face shield to protect teeth. Routine dental checkups for early detection of the issues by monitoring occlusal or the contact points. So now we'll discuss about the treatment options for the cracked tooth syndrome. The primary goal for treating a cracked tooth is to relieve pain and prevent the crack from getting worse. With early intervention and appropriate treatment, most cracked teeth can contribute to function and allow for comfortable chewing for years. But what happens if the tooth is not treated? If a cracked tooth is left untreated for too long, it can lead to split tooth, where the crack has caused the tooth to break into two or more pieces. The extent of the crack will determine whether any part of the tooth can be saved. Even with treatment, some cracks may continue to progress, resulting in the need for tooth extraction eventually. So, treatment based on the crack location. If the crack extends to pulp, it's treated with root canal procedure. Afterwards, a crown placement is important over the tooth to protect it and prevent the crack from spreading further. Placing a crown on a cracked tooth provides maximum protection and helps to stabilize the tooth. However, it's important to note that while crowns can significantly reduce the risk of crack worsening, they don't always guarantee success. Some cracks may continue to develop despite the crown. If the crack line extends below the gum line, it becomes very difficult to treat. In such cases, early intervention is essential to prevent further damage. If left untreated, the crack can worsen and possibly leads to the tooth loss. In case of vertical root fracture, in some cases, endodontic treatment may help to preserve the part of the tooth, but prognosis is generally poor if the fracture is extensive. I would summarize the treatment options. Here, the early diagnosis and intervention are essential for preventing further damage. Root canal treatment and crowns are common solution when the crack reaches the pulp or extend deep into the tooth. If left untreated, cracks can progress into split teeth, which may lead to tooth loss. Crowns offer protection, but they may not guarantee success in every case. In conclusion, addressing cracked tooth syndrome early on gives the best result for saving the tooth and restoring its function for years to come. The process of cracked tooth, it depends upon the location, direction, and the size of the crack. So, if the crack is superficial, generally the treatment involves filling or crowns to restore the tooth. In these cases, the prognosis is excellent as these cracks are usually minor and don't involve the pulp of the tooth. In case of minor cracks, they often into dentin only but not the pulp involving. So treatment generally involves placing a filling or a crown to protect the tooth. Prognosis is good for minor cracks as well. These fractures can repair successfully as long as pulp remain unaffected. In case of deep cracks with pulp involvement, they extend into the pulp. Root canal treatment becomes necessary to remove any infected pulp tissue. After root canal therapy, a crown is placed to restore and protect the tooth. The prognosis for these cases is poor but still manageable with treatment. And in case of worst case scenario where the crack extends into the root, in these cases where the cracks extends deeply into the roots of the tooth, reaching beneath the bone, the tooth cannot be repaired. The only option is to extract the tooth, repair it with either a dental implant or dental bridge. Prognosis is considered hopeless in these cases as the cracks involves both the pulp and the root, making restoration impossible. Thank you for joining me in understanding cracked tooth syndrome. Your support inspires me to create more educational content. If you found this video helpful, please like, share, or subscribe for more dental health insights. Let's keep learning together. See you in the next video. Till then, bye bye. Take care.